You know the political season is heating up. Candidates are announcing. People who have never been in the political arena are now stepping forward to run for offices. We had Dr. Zama in a few weeks ago. He's running for governor of Pennsylvania. Never been in politics, but now I want to bring you a candidate for Senate. Another doctor. Something about this pandemic that has inspired doctors to run for office. And I can't tell you that's a bad thing because we've seen what businessmen have done in this pandemic. But I want to welcome into the pastor's office candidate for the United States Senate. He is the chief of emergency and urgent care services at Pennsylvania Hospital. He has been a practicing physician for 30 years, and now he's pivoting to get into politics. Come on in the pastor's office, Dr. Kevin Baumlin. Dr. Baumlin, welcome to the pastor's office.
Thank you so much, Reverend, for having me on your show. I really do appreciate it. Just a little point of clarification. I did retire a couple weeks ago so I could run full-time, so I'm still a professor of emergency medicine, but no longer the chair at Penn. I have been providing care to patients on the front line in emergency rooms for the last 30 years, and I do want to take a minute to thank you for your relentless support for COVID vaccines and encouraging people to get out and get vaccinated. Your work is important. We've lost 29,814 souls to COVID so far in Pennsylvania alone, 33 right here in Philadelphia alone. It's just devastating.
Well, first of all, let me two congratulations coming your way. One is for your retirement that happened just a couple weeks ago, and the second. Today is your birthday, so happy! I believe it's 57th birthday. Am I correct?
That's very true. Thank you so much.
All right. So happy birthday to you. But Dr. Baumlin, listen, you navigated Pennsylvania Hospital through the high point and most critical point of this pandemic. Talk to us about what that experience was like for you.
So it was actually a life-changing experience. It's what inspired me to go from physician leader and executive, someone who's run emergency departments, large organizations and urgent care centers throughout my career, been an expert in information technology and a researcher, in particular in older adults and how we care for them, which reminds me, how is your mother? How's she doing?
Well, first of all, I can see that you do research before you come on a show. So thank you very much for asking about my mom. Mom is downstairs right now. We have an afternoon service starting at 3:30. She's 88 years old, and she is battling Alzheimer's. And all I share with people is I live in the moment with her and enjoy the moment with her. And as long as I can see her smile in the moment, I'm all right, doctor.
Well, your mom and so many like her are what I've dedicated my life to. I've been a passionate care provider for 30 years. My specialty is older adults, and I've been trying to work towards improving how Medicare works for older adults. Just speaking of your mom makes me think of one of my patients I cared for during just a couple months back during the pandemic. A gentleman, for the sake of our conversation, we'll call him Mr. O. I knew him for only 4 hours, sadly. He came to me and talking and was brought in by a private car by one of his daughters, who actually wasn't one of his 5 daughters, was his neighbor who he's very close with. He was kind of like the mayor of his block. And we spoke about what his wishes were, whether or not he wished to be intubated, which means put on a breathing machine if it came to that for his COVID pneumonia. And he said to me, no, if it comes to that, I want to go with God. It's okay. I've lived a great life. And, pardon me. He got sick very quickly. And 4 hours later, I was at his bedside holding his hand when he died.
Wow.
And he's a Hispanic gentleman and believed in a lot of misinformation about COVID vaccine. And his community was being fed, and still continues to be fed, untruths and falsehoods about vaccine and how it can save lives in our community and, importantly, save other people's lives. Because you get a vaccine, you're helping others. Isn't that what it's all about? Isn't that what it's about, to be Christ-like, to care for yourself and your neighbors and your community? Getting a vaccine is not just about you. It's about others as well. And I know from that experience, after going to the next room and crying for a little bit and pulling myself together and thinking about how I can change my mission in life and make a bigger focus and help more people, fix Medicare, make it better for older adults, bring home care for people like you so you can have 4 hours of paid home care by a qualified profession that's part of your Medicare benefits. We can do that. We can do these important things of changing the payment model so we can honor primary care, mental health services, urgent care services, places of entry for people that are in the community. If the system pays more for those services, we'll have better access and have better care for everybody in our communities all across the Commonwealth.
So you share that the pandemic changed your life and caused you to want to jump into politics, but this world of politics that you're jumping into, Doctor, is not like the politics that we grew up witnessing and observing. I've loved politics all my life, and I oftentimes bring up the fact that, Reagan and Tip O'Neill were in different parties, but after they got done fighting during the day, they went to the White House and had a drink at night. Politics has become very personal. It's become so partisan that we're not getting anything done. I was looking at an article, an op-ed from Representative Jordan Harris that he put out a couple weeks ago. There's $7 billion that Pennsylvania received as a result of the pandemic, federal funds that they won't spend. They're putting it into a rainy day fund instead of spending it where it's needed because the Republicans and Democrats can't come together to make a decision. Doctor, you've been in medicine for 30 years. How do you come into politics now and help to heal some of these wounds so we can get something done for the people that need it?
Yeah, I haven't been in the body politic. I tell my campaign team, I feel a bit like the foreign exchange student in senior year of high school, kind of just plopped into all these cliques and clubs and relationships, and I'm definitely the outsider. And I'm okay with that. As a chair of emergency medicine, my job has always been to advocate for resources for those in need, for the homeless, for those with substance use disorder, getting them treatment instead of incarceration, getting people food who have food insecurity, just getting an older adults meals delivered to their home that are prepared sometimes is the best thing you could possibly do as an ER physician. It makes your day. It seems like a little thing, but it's a big thing. These somewhat impossible things are doable, and they're doable by leaders who actually care and have been working in the space of providing care for people all their adult lives, and that's what I've been doing. I know that I can work with leaders across the divide, including my own family, frankly. I have a split family like many that are out there. My parents and my brother are both diehard Republican Trump folks, and my sister and her boyfriend are Democrats and advocates for the diversity in our life and in our culture. But you know what? We get along. You find out what common you have and you work on that. And I know what's common is better health care, better jobs, and better education. Who doesn't want those common things for everyone in our society? We can find common ground. We can work on making older adult care better. We can work on getting rid of co-pays and deductibles because that really only helps insurance companies, not people, not working hard people. No one needs to have a $9,000 deductible when they only make $45,000 a year. These are things that we can figure out together. We can figure out how to pay a living wage so that when someone goes to work 40 hours a week, they can make at least $20 an hour. Why? So you don't have to go to a second shift job. Those are the things that build a society and bring back parents in front of their kids, because right now what we have is kids going to school in classroom sizes of 1 to 30, 32, right down the block from me actually, and then parents who aren't home when they get there because they're working second shift. These clear, decisive, and needed things are what we need to do to build our society back together and provide home care for our older adults and child care for our kids so we can really get back to the work of caring for each other again. Those are universal things, and I don't think they split down party lines. And if they do, I can have a clear conversation with them about what it means to be part of a society and a democracy that cares for each other.
So, Doctor, one of the first things that we really need to do is we need to get out of this pandemic. And President Biden has called it now the pandemic of the unvaccinated. If you are elected to the Senate, and Lord willing, this will be behind us by then. But what we've been told is that there are more coming. How do we protect ourselves against another shutdown? How do we protect ourselves against the last 18 months? What do we do going forward in your mind as a doctor, as a medical professional?
Well, one of the things we need to do is stop politicizing healthcare and health policy. There are no physicians on the Democratic side in the Senate, haven't been one in 69 years. What I bring to the table is a voice of science, a voice of reason, a voice of compassion from my years of experience. We also need to invest in science and technology and listen to the scientists as we move forward and address problems with very clear messaging so that we can move ourselves and our country forward. That's why I'm supporting vaccine mandates and requirements so that we can go back to our lives. Mandates work. We've seen this in New York and New York City public schools. We've been doing vaccine mandates in healthcare for many years. No flu vaccine, you can't come to work. It's pretty simple. No vaccines, you can't go to school. It's simple. We need to do this for the we, not the me. And those kind of seemingly simple messaging and investments in our future, we can also invest in education and infrastructure by getting our classroom sizes down to 1 to 12 and building infrastructure in our schools with good air exchange so that when the next respiratory virus comes, we don't have to shut down because our kids are in small enough classroom sizes with good air exchange, with staff members that are vaccinated, with investments in rapid testing so that we can, as providers, can identify and quarantine people who are sick rapidly. These are kinds of the things that we can do, but we can't do it with leaders like the Trump supporters who are vaccine deniers. We can't do it with people who aren't engaged in the science and aren't out there leading and taking a risk saying, we need vaccine mandates. I know it's not popular, but we have to do that. I call on my fellow candidates to support me in this because it's the right thing to do, to support our president, support mandates so that we can move on as a country, as a people, as a state and a city.
So when we look at some of the effects of the pandemic, and I kind of stay on this line because it is the pandemic that you said that has kind of motivated you to make this run. One of the glaring things that we've seen is education inequities by zip code. I've asked a couple of your opponents about this, and I want to ask you, how do we cure that going forward? What would be your plan as a member of the United States Senate? Yeah,
it's one of the great leftover wrongs that we failed to right in our unequal and not yet equitable society. When you go out to the suburbs of Melbourne and you see a playground, it's beautiful grass, a football field, trees for shade, and then you go when I was out giving vaccines in Philadelphia and West Philadelphia in schools, there's, macadam, no trees, no football field, no grass to run around and play, and no playgrounds with equipment that's safe for kids to play on. We have to make the infrastructure investment in public schools and take a look at how we fund public schools in inner cities and make this investment, this long overdue payment forward to rise up our children so that they can be part of an better educated society and right the wrongs of the past through education and empowerment. We need to make the investment of 1 to 12 classroom sizes. We need to stop investing in charter schools and private schools and schools that don't think about nor invest in the best public education possible. We need to look at the model and redo it and start over and make sure that the public schools in our inner cities are better than the private schools in the suburbs. And then we can start talking about equity and equality. But until we do that, we're nowhere. I have a learning difference. I'm dyslexic, so I know what it's like to be in a classroom where you're like, I can't read that, I can't spell that, I don't know what's wrong, but I just don't get it and I don't understand. And I know that kids that are given the advantage of 1 to 12 classroom ratios can be identified and they can get early intervention so that they can learn to read and they can strive and be better. But if we don't make that investment in kids and teachers and education, we'll never be the society, the democracy that we want to be in the future.
Another issue that is certainly in the headlines and certainly impacting cities across the country, and we just talked about it in our previous interview with Movita Johnson-Harrell, is gun violence. And it just seems like we can't get any meaningful reform legislation through the Senate. Every time it comes up, it seems like the Republicans do their best to shoot it down, and they've been successful. But yet and still, every other week, we're hearing about shootings in our schools. One in Memphis last week, one in Texas this week. It's not become a once a year, twice a year thing. It's become monthly. How do we get some real legislation through Congress that can stave off some of this gun violence that we're dealing with in our country?
Yeah, I've written about and spoken about gun violence in the past, and it is a passion issue for me because I've been that doctor who's had to go in the room and tell a loved one that their son, daughter, wife, husband has been shot and killed or been shot in the head, and we need to harvest their organs. What a devastating conversation that is. It stays with you for the rest of your life. And I feel quite strongly that we need to do a multi-pronged approach. It's not just getting the ban on assault rifles reinstated, which is absolutely imperative and important piece of moving forward, but it's also investing in our communities through grants and not just loans, redirecting money into infrastructure for our schools and playgrounds, which I talked about, and our community gardens. Gina South over here at Penn has done some great work talking about how community gardens can make a difference in building communities together and planting trees to decrease the temperature on that block. These are simple, doable things we can start today. Funding schools and community programs, and last but not least, decriminalization of the use and distribution of drugs of abuse. That the leftover Jim Crow laws that put people in jail for using drugs and make essentially the best paying job in a given neighborhood is distributing drugs. We have to stop that, end that, decriminalize, and have good sound taxation and control policies on drugs of abuse so that we can get people out of drug distribution and into storefronts and get people into treatment instead of into jails, and stop incarcerating people and start loving them and treating them like the human beings that they are. These 5 points are part of my 5-point plan for ending gun violence. They're interrelated. They need to be done together and in concert and with good sound leadership. I know about this. I care deeply about this problem, and I'm a leader who can move the agenda forward.
You're listening to Philly's favorite 100.7 FM and 99.5 HD3. We're talking to Dr. Kevin Baumlin, candidate for the United States Senate. And Dr. Baumlin, you are speaking to an exclusive audience. You're speaking to a gospel audience. This is the only FM gospel radio station in the city of Philadelphia. Give them, I'm not saying you won't be back before the election, but give them a final appeal. In this particular interview about why they should consider you over and above your opponents. for U.S. Senate?
Well, I am the candidate who's had 30 years of experience caring for people. That's my life's work. That's my mission. I was speaking just this week with a group of people out in Harrisburg, and they were saying, why would you give up your career as an emergency physician and ever consider going into politics? Because I really do care. I want to make things better on a federal level. I want to make Medicare better for older adults. I want to make education better for kids and teachers. I want to make jobs better so when you have the dignity of work, the least we can do is make sure you have a living wage so that when you go to work, you can work just one job instead of two. I'm not doing this for political gain. I had a wonderful job. I have a wonderful life. My husband and I live here in Philadelphia, and we're extremely happy and are incredibly blessed and lucky.
And you have a great looking dog too.
That Duke, he's great. He's a handful, but we love him.
Absolutely.
He's really beautiful and quite a cuddly pooch. I really do believe that I'm the candidate who could win in the general. I care very much about people and how they're struggling and succeeding and sometimes falling down. I know that I can help make things better for people across the Commonwealth and, frankly, across this country. I look for the support. This is a marathon and not a sprint, and I say all the time we have a 17th Amendment to the Constitution in 1913, and that amendment said that voters get to decide, not political operatives, not parties. You, voters, get to decide who our next senator would be. Please go to Dr. B, the number 4 PA, DRB 4 PA. Look me up, take a look, follow me on social media, and you get to make your own decision as who you want to be the next U.S. Senator from Pennsylvania. I thank you so much for your time, and Reverend, I so much thank you for your support and allowing me this platform to talk about my candidacy.
Dr. Baumlin, thank you for coming into the pastor's office today. We wish you all the best as the primaries approach. And again, we hope to have you back to talk to our Philly's favorite listeners in the near future. God bless you, sir.
Thank you. Anytime. Have a great Sunday.
Bye-bye.
While you are listening to Philly's Favor. Yeah.